patients with mobility impairments, wheelchairs are not optional devices. They are essential tools that preserve independence, safety, and quality of life. Yet, despite this critical role, administrative and financial barriers continue to impede access. Hello, my name is Margaret Crosby, and I'm a resident physician at Hennepin Healthcare in Minneapolis, Minnesota. In an upcoming issue of Mayo Clinic Proceedings, in collaboration with Dr. Arjun Gupta and other physicians at the University of Minnesota, we are publishing an article titled Simulated Experiences Accessing Standard Manual Wheelchairs Through Medicare-Listed Suppliers. To better understand this problem from the patient perspective, we conducted a secret shopper study simulating the real-world process of obtaining a wheelchair through Medicare's official supplier directory. Here's what we did. Using Medicare's Medical Equipment Supplier Directory, we identified the first 30 suppliers within 10 miles of two urban zip codes that listed standard manual wheelchairs, Chicago, Illinois, and Minneapolis, Minnesota. Over a 2-week period in March 2025, one investigator contacted each supplier, posing as a family member seeking a wheelchair for a Medicare beneficiary at home. We inquired about availability, insurance acceptance, documentation requirements, and expected out-of-pocket costs. Our findings were striking. Of 60 suppliers, we successfully were able to reach 51, or 85%. Among those reached, only 36 reported having a wheelchair in stock, and only half accepted Medicare insurance. Most suppliers required documentation beyond a prescription, including clinician notes or additional forms. Furthermore, 42% of suppliers reported that delivery would take weeks or were unable to provide a clear time frame. On the financial side, cash purchase was almost universally available, with a median quoted price of $300 and a median rental price of $99 per month. While these amounts are within general retail range for wheelchairs, they represent substantial out-of-pocket expenditures for older adults, particularly when suppliers decline Medicare coverage. Taken together, these data highlight several important points. First, Medicare-listed suppliers frequently do not accept Medicare, creating confusion and barriers for patients. Second, administrative hurdles such as inconsistent documentation requirements and prolonged or uncertain timelines further limit access. Finally, cash pay remains a common fallback, shifting costs directly onto beneficiaries. These findings underscore the need for targeted reform policies. Greater accuracy in Medicare supplier directory, clearer and more standardized documentation requirements, and transparent expectations for delivery timelines would help reduce barriers to access. Importantly, additional research is warranted to better understand supplier-side challenges, including the financial impact of Medicare reimbursement rates and administrative compliance. In conclusion, this secret shopper study demonstrates that significant obstacles remain for Medicare beneficiaries attempting to obtain a standard wheelchair, even when using Medicare's own supplier directory. As clinicians, we recognize the profound impact that timely access to mobility aids has on health outcomes, independence, and quality of life. Our results call for urgent attention to policy and system-level changes that can better align durable medical equipment access with the needs of vulnerable older adults. For further information, please see our article in an upcoming issue of Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.